Traditional health practitioners say the proposed regulation perpetuates the marginalization and exclusion of traditional healing practices in the country's healthcare system. They complain that the process to add new regulations to the Act did not follow inclusive and comprehensive consultation. The draft regulations, gazetted in June 2024, outlines the process which traditional health practitioners should follow in registering with the Council. It also details who qualifies to register, categories covered by the Act, and the fees to be paid by traditional health practitioners when registering with the Interim Council. They are expected to pay a fee of 5,000 rands to register with the Interim Traditional Health Practitioners Council. They want the minister to implement fair, transparent, and equitable fee structures they can afford.
Those they have proposed that we don't know that suggest a registration of 1,500 and 5,000. That's what we can't accept. That's what we feel is oppressive, because as traditional healers, we don't work the same and we can't control the spirit. There's no way you can control spirit.
I'm very sad over these regulations. We are not going to pay this 5,000 rands. That's my take. Let them call us. They must call all traditional healers and hear our views, not give us theirs.
The protection of indigenous knowledge is also a concern to them. They say the requirement on them to disclose their indigenous practices and knowledge are a direct violation of their right to protection of indigenous knowledge.
The aim and the purpose of this government, we are saying no to regulation without healers.
Officials from the Department of Health accepted the memorandum, saying the concerns have been noted and will be passed to the health minister.
As a department, we recognize that it is an exercise of their constitutional responsibility, and the specific request to us is to pass the memorandum to the national minister to make sure that the activity that has taken place in the province as part of the national activity is recognized. So we have committed ourselves to do exactly that.
The traditional healers also demand a commission of inquiry to be established to determine whether the Department of Health is a suitable policy home for them. SABC News, Bloemfontein.